Hello, everyone, and welcome back. If you're in the final weeks of pregnancy, chances are you've asked yourself at least once, did my water just break? It's one of the most common questions expecting moms have, and honestly, it's completely understandable. Your body is changing every day, you're noticing new sensations, and suddenly every damp feeling has you wondering whether labor is about to begin. Many women expect their water breaking to look exactly like it does in movies. You know the scene: a pregnant woman is standing in a grocery store or walking through a restaurant when suddenly a huge gush of water pours onto the floor. Everyone stares. Someone yells, "The baby's coming!" And it's an instant rush to the hospital. Real life is usually much less dramatic. For many moms, especially first-time mothers, it isn't always obvious. Sometimes it's just a slow trickle. Sometimes it's a small damp spot in your underwear. Other times it's simply sweat from a hot day or a tiny leak of urine because your growing baby is pressing directly on your bladder. If you've ever found yourself standing in the bathroom wondering, was that my water or did I just pee a little? You're definitely not alone. In today's video, we're going to walk through everything you need to know about identifying whether your water has actually broken. We'll talk about what amniotic fluid is, how it compares to normal pregnancy discharge and urine, the signs that mean you should call your healthcare provider immediately, and what usually happens after your water breaks. By the end of this video, you'll feel much more confident recognizing the difference and knowing what your next steps should be. Let's start with the basics. What exactly is amniotic fluid? During pregnancy, your baby grows inside a protective sac called the amniotic sac. This sac is filled with amniotic fluid, a remarkable liquid that plays a vital role in your baby's development. Amniotic fluid cushions your baby from bumps and pressure, helps regulate temperature, allows your baby to move freely so muscles and bones develop properly, supports healthy lung development as your baby practices breathing movements, and protects the umbilical cord from becoming compressed. Your body constantly produces and replaces this fluid throughout pregnancy. As your baby grows, the amount changes, but throughout most of your pregnancy, there's enough fluid to create a safe, comfortable environment for your little one. When people say my water broke, they're referring to the amniotic sac developing an opening. Once this happens, the fluid begins leaking out through the cervix and vagina. Sometimes that opening is large, sometimes it's tiny. And that difference is why recognizing it isn't always easy. Does everyone's water break before labor? Here's something that surprises many parents. Not everyone's water breaks before labor begins. In fact, many women begin having regular contractions while the amniotic sac is still completely intact. Their healthcare provider may eventually break the water during labor, or it may rupture naturally much later. Only a minority of pregnancies actually begin with the water breaking first. So if you're waiting for your water to break as the first sign of labor, know that labor often starts with contractions instead. Why it's so easy to get confused. Late pregnancy comes with plenty of unexpected surprises. Your growing uterus presses down on your bladder almost constantly. Your pelvic floor muscles are working harder than ever. Hormonal changes increase vaginal discharge, and depending on the weather, you may simply sweat much more than usual. That means several completely normal things can leave your underwear feeling damp. This is why so many expecting moms become detectives every time they go to the bathroom. Is it discharge? Did I accidentally leak urine? Could this actually be amniotic fluid? Let's look at each possibility one by one. Could it just be pregnancy discharge? One of the most common causes of increased moisture during late pregnancy is normal vaginal discharge. Pregnancy hormones stimulate the cervix and vaginal tissues to produce more secretions. This discharge helps keep the birth canal healthy and protects against infection. Normal pregnancy discharge is usually white or clear, creamy or slightly thick, mild smelling or odorless, consistent throughout pregnancy. You may notice more of it as your due date approaches. While it can certainly make your underwear damp, discharge usually doesn't continue flowing once you've changed your underwear or inserted a fresh panty liner. It also doesn't typically soak through clothing. Could it be urine? Urine leaks are incredibly common during pregnancy. As your baby grows heavier, more pressure is placed directly on your bladder. Even women with very strong pelvic floor muscles can experience occasional leakage. You might notice small leaks when you sneeze, you cough, you laugh, you stand up quickly, you exercise, you lift something heavy. Urine is usually yellow, although if you've been drinking lots of water, it may appear almost clear. Most importantly, urine usually has a recognizable smell. Once your bladder empties, the leaking generally stops. What does amniotic fluid look like? Amniotic fluid often looks different. It's usually clear. Sometimes it's slightly cloudy. Occasionally, it may have a faint pink tint because of a small amount of blood from the cervix, especially near labor. Most women describe it as having little or no odor. Some even notice a slightly sweet smell. Unlike urine, amniotic fluid often continues leaking because your body keeps producing more fluid even after the membranes have ruptured. You may notice that every time you stand up, walk around, or change positions, another small amount leaks out. That's because gravity helps the fluid escape. Big gush or slow leak. Hollywood has convinced many people that water breaking always means gallons of water suddenly pouring everywhere. That certainly can happen. A large rupture in the membranes may cause a dramatic gush of fluid, but many women experience something much more subtle. A small tear in the membranes can create a slow leak that lasts for hours. Instead of one dramatic event, you simply notice that your underwear keeps becoming wet no matter how often you change it. This is why paying attention over time is often more helpful than judging a single moment. High leak versus low leak healthcare providers sometimes describe two general patterns of membrane rupture. A high leak happens when the opening is near the top of the amniotic sac. Because your baby's head can act like a plug, only small amounts of fluid may escape at a time. You may notice occasional dampness rather than continuous leaking. A low leak occurs closer to the cervix. These leaks often release larger amounts of fluid, especially when you stand, walk, or change positions. Both situations deserve evaluation by your healthcare provider. The important thing isn't trying to diagnose exactly where the leak is, it's recognizing that persistent leaking may mean your membranes have ruptured. A helpful way to remember what to check. If you think your water may have broken, don't panic. Instead, take a moment to observe what's happening. A simple way to organize your thoughts is to remember 4 things. First, note the time. When did you first notice the fluid? Second, estimate the amount. Was it just a few drops, a steady trickle, or a large gush? Third, look at the color. Is it clear, pink, yellow, green, or brown? Finally, notice the odor. Does it have no smell, a sweet smell, a urine smell, or a strong, unpleasant odor? These observations will be extremely helpful when speaking with your healthcare provider because they provide valuable clues about what's happening. Remember, you don't have to diagnose yourself perfectly. Your job is simply to observe and report what you're experiencing. Now that you know how to recognize the possible signs of amniotic fluid, let's talk about the next question almost every expecting mom asks. What should I do if I think my water broke? The first thing to remember is this: try not to panic. Even though it can feel exciting or even a little scary, your water breaking does not always mean your baby will be born immediately. In many cases, you still have time to stay calm, gather information, and contact your healthcare provider for guidance. If you're at home and you suddenly notice a gush or continuous trickle of fluid, take a deep breath. If possible, head to the bathroom and empty your bladder. Sometimes what feels like leaking is simply urine, and once your bladder is empty, the leaking stops. If the fluid continues after you've used the bathroom, there's a greater chance it could be amniotic fluid. Many women find it helpful to put on a clean sanitary pad, not a tampon, and monitor what happens over the next hour. A pad allows you to see how much fluid is leaking, what color it is, and whether it continues steadily. Avoid using tampons because they can increase the risk of introducing bacteria into the vagina after the membranes have ruptured. As you're observing the fluid, continue paying attention to your baby's movements. Is your baby moving as usual? Most babies continue to move normally after the water breaks. If you notice a significant decrease in movement or your baby seems much quieter than usual, contact your healthcare provider right away. When should you call your provider? Anytime you think your water has broken, it's a good idea to call your doctor or midwife. Even if you're not completely sure, they can ask questions about what you're experiencing and help determine the next steps. Be prepared to answer questions like, what time did the leaking begin? Was it a gush or a slow trickle? What color was the fluid? Did it have any odor? Are you having contractions? Is your baby moving normally? Have you noticed any bleeding? These details help your healthcare provider decide whether you should come in for an examination or continue monitoring at home. When is it an emergency? Most cases of ruptured membranes are not emergencies, but there are certain situations where you should seek medical attention immediately. If the fluid is green or brown, it could indicate that your baby has passed meconium, which is your baby's first stool. While this doesn't always mean something is wrong, it does require prompt evaluation because your healthcare team may want to monitor your baby more closely during labor. If the fluid has a strong foul odor, it could be a sign of infection. You should also seek immediate medical care if you experience heavy vaginal bleeding, severe abdominal pain, fever, chills, or if you notice that your baby's movements have significantly decreased. Another rare but serious emergency is if you feel or see something coming out of the vagina after your water breaks, such as the umbilical cord. This is called a cord prolapse and requires emergency medical care right away. Fortunately, this is uncommon, but it's important to know the warning signs. What happens at the hospital? If your provider asks you to come in, you may wonder what they'll actually do. Usually, one of the first steps is confirming whether the fluid is truly amniotic fluid. This can often be done with a simple sterile swab that tests the fluid. In some cases, your provider may perform a gentle speculum exam to look for pooling of fluid in the vagina. They may also use an ultrasound to assess the amount of amniotic fluid around your baby. You'll likely have your baby's heart rate monitored to make sure everything looks reassuring. Your temperature, blood pressure, and other vital signs may also be checked because healthcare providers want to make sure there are no signs of infection. What if labor doesn't start right away? This is something that surprises many parents. Just because your water breaks doesn't necessarily mean contractions begin immediately. For some women, labor starts within minutes. For others, contractions begin several hours later. Some may even wait close to a full day before active labor naturally develops. When the membranes rupture before labor starts at full term, it's called premature rupture of membranes, often shortened to PROM. Despite the name, premature in this case doesn't mean your baby is premature. It simply means the membranes ruptured before labor began. Many healthy women with term pregnancies go into labor naturally within the next several hours. Why do providers monitor the clock? Once the membranes have ruptured, there is a pathway between the outside world and the uterus. Over time, this can increase the chance of bacteria entering the uterus, which raises the risk of infection. That's why your healthcare provider will usually keep track of how long it's been since your water broke. However, it's important to understand that this isn't usually an immediate emergency. Many healthy pregnancies remain perfectly safe while labor begins naturally, especially when there are no signs of infection and both mother and baby are doing well. Your healthcare team will consider many factors before recommending the next step. Factors that influence the plan. Every pregnancy is unique. Your provider may consider how many weeks pregnant you are, whether you're Group B strep, GBS, positive or negative, whether contractions have started, your baby's heart rate, the color of the amniotic fluid, your temperature, whether there are any signs of infection. All of these details help determine whether waiting for labor is appropriate or whether medical intervention is recommended. Can you stay home? For many healthy, low-risk pregnancies at full term, some providers may allow you to remain at home for a period of time while waiting for labor to begin naturally, as long as you're following their instructions carefully. During this time, you'll likely be encouraged to monitor your baby's movements, check your temperature if instructed, stay hydrated, avoid inserting anything into the vagina unless advised by your provider. Contact your provider if contractions begin or if anything changes. Always follow the recommendations of your own healthcare provider because every pregnancy has different circumstances. Should you avoid vaginal exams? One important topic worth mentioning is vaginal examinations. Each vaginal exam after the membranes have ruptured may slightly increase the chance of introducing bacteria into the uterus. For that reason, healthcare providers generally avoid unnecessary internal exams and only perform them when medically needed. If labor is progressing normally, limiting unnecessary vaginal examinations can help reduce the risk of infection. This is one reason why communication with your healthcare team is so important. They'll balance gathering useful information while minimizing unnecessary procedures. By understanding what's happening inside your body and knowing what to expect, you can approach this stage of labor with much greater confidence instead of fear. In the next part, we'll discuss common myths about water breaking, answer frequently asked questions, explain whether your water can break while you're sleeping, and share practical tips to help you stay calm and prepared for labor.